Well, Chantal, I don't even know what to say about this. I mean, like, I've got some words, but um, your story is still not adding up, and just showing yourself in a picture sitting in a wheelchair on the outside of a clinic. What does that mean to me? What is that supposed to mean to me? You literally could have pulled that from one of the carts and just sat there for a photo op. I have no idea what you're doing right now.
Okay, I have a picture to share with you. So I went to the clinic, back to the clinic, to the doctor today.
Mm-hmm.
It was pretty interesting. Usually when I go to the clinic, it's very uneventful. I find, like, I don't know, I guess if I lift my arm in the air, my right arm, it kills. I could feel it in my leg. It's so weird. I don't know.
It's not funny how she started to have right arm problems the day after I started complaining of pain in my right arm. I can't even with this chick.
How that works. It's like the arm bone's connected to the leg muscle. I don't know. Something like that, you know? Okay, listen to...
No, it's not. It's not. It's not. It's not. Okay? You were literally just making shit up. I can't even.
This before I get to my health update. Where is it? Happy, happy, happy. Okay, somebody wrote a comment. Girl, now these haters are out there suggesting that you can't show yourself because your hubby is physically mistreating you. Good Lord with their insanity theories. Alright. And then they say, I don't know if you've said it yet, but you might have to actually explain to these people with zero common sense that you are not feeling well. Therefore, you're obviously not going to get up and put your hijab thing on and no, you don't sleep in it. Like, they really, really can't just think any bit of common sense.
Well, yeah, I mean, I don't know. You said that you had to keep your entire body covered except for your lower back to allow some sunshine to come in through a window, which means it's filtered, so you're not actually getting the full effects of the sun, right? But I'm sure that you and your crazy ass fan base know much more than everybody else.
LOL, I swear they are thirsty today. Okay, so by that logic, so if you're going to apply that logic to me, the streamers who apply that logic to me or whoever, why are you not applying that same flawed logic, by the way, to yourselves? Because so many...
Well, I think you know very well, Chantel, that I show my face all the time. That I have no problem going live and showing my face. So you can't just make that like a grandiose statement about every React channel. Period. Not to mention you've like dug up photos on your biggest haters, right? Like the haters, right? The React channels that you have the biggest problems with, you've dug up photos on them. I've put myself right the fuck out there, Chantal.
I would say either half or the majority of streamers or content creators or whatever don't cam up. So does that mean that you're being abused and your partner is abusing you? Is that why you're not?
And the ones who do cam up, you come up with stupid ass things like, your voice sounds gay. Right, Alex? You're such a bigot. I can't even with you, Chantal.
Camming up? Like, that's just... To me, that's... Apply the same logic to yourself in that sense, okay? So, no. The only reason is, again, because I'm in my bedroom, I'm comfortable with no hijab, and I can't just turn on my kid. Like, if it was me, like...
You literally could have been lying naked in your bedroom, and nobody would have cared. Not your religion, nobody. You don't have to be covered at all times. You have even said this, that you can take your hijab off in front of your family and friends and so on and so forth, right? Well, I'm sure you can be completely naked in your bedroom if you're uncomfortable. Yes? Yes. So I don't know why your story arc gets weirder and weirder with every stream.
A year and a half ago when I wasn't Muslim, yeah, sure, I was in my bed from the llama in a bra. I didn't care. But now I can't do that. So I'm pretty.
You've never been Muslim. You've been cosplaying the entire time. You literally said you don't believe in God just a month ago. So just stop trying to act like you're pious because you're not.
Much bedbound at this point. No, he would not harm me. No. He has never laid a finger on me ever. Yeah, people like to do that, comparing some text messages with real life, and no. Okay, so I'm going to show you a picture of me at the clinic being miserable. Just give me a sec here.
Okay.
Happy, happy, happy. Here I am. By the way, I did a weigh-in today, and I have a whole...
Dude, you look like you're fucking 80. You look like you're fucking 80 in this picture. And it proves nothing. It shows you sitting in a wheelchair outside of a clinic. You literally could have pulled that out of a fucking cart. Like, they have the cart areas where you actually, like, pull the wheelchair out. I can't even, dude. This is supposed to be your proof? For fuck's sake.
A vlog coming out after my live stream sometime. I just have to finish editing. I look like I'm like passing gas or something. I'm in a wheelchair, yeah, because
Why did you even say that? Like, I don't think anybody would have like come to that conclusion other than you're trying to like signal to your fucking crazy ass boyfriend, fake husband about flatulation. Like, why would you even say that? I mean, nobody's looking at this picture and being like, oh, she's obviously taking a fart right now. Nobody is fucking looking at that picture, Chantel, and thinking that. But you're the one who's like, oh, Salah's watching this video right now, and I know he likes having shit and piss all over the place, and that's why people think I have pink eye. I can't even, dude.
I'm in a wheelchair because I was able to walk. The most painful thing is getting into the car and getting out of the car, because the way I have to into the SUV, right? So I was able to walk up the ramp. I walked slowly, but I walked, kind of dragging.
Yes, describe it. Tell me exactly how this goes, because I have no idea. I don't have to deal with this on a daily basis, Chantel. So tell me exactly what it's like to have a nerve condition and have to get into a car. Tell me how it goes.
My leg. But then there was like this weird emergency. We're in the clinic and there was a...
Wait a minute. I thought you were just like leaving. What happened here? Thought you said you were getting in the car. Okay.
A really like tragic emergency. I won't go into it, but somebody had a tragic emergency, and so the doctor that was there, that we had, usually it's in and out.
So this is not an urgent clinic. This is basically she did another ER visit so that she could just have more for her story. Oh my God, this is so crazy that she does this.
But I needed to follow up, and they wanted to follow up how my pain was, and if I need more injections and stuff like that. I basically,
You're not getting any fucking injections. Give me a break. Because you don't have you don't have regular treatment. Okay? So, you're not getting the kind of injections that you're talking about. You have not set up some sort of treatment plan where they have a schedule for you to actually get injections, because the way you've described this is just physically impossible. They're not going to do it for you like that.
I reached my limit with standing, and as you can see, I'm very uncomfortable. I have to kind of like lift myself, because if I sit fully on my bum, on my backside, the pain shoots up. So I'm kind of like in this position, and we're there for about another 30 minutes. And, you know, we had to go to another doctor at the other end of the clinic, who was taking over for the patients.
Wow, that sounds fucking horrible. I'm sorry. You had to wait like 30 fucking minutes. That's horrible, Chantal. That is so bad. That is absolutely tragic.
Of this one doctor who was called to the emergency. So I just sat in the wheelchair, and Salah went in and talked to the doctor, and in and out, you know. So things are a bit different here. It's not by, like, imagine you're at a clinic, right? You don't just go up to somebody and say, like, you know, like they kind of talk amongst themselves, the people waiting, and if like your problem is just you need a prescription, they'll let you go. Like, the people are so nice here. They're like, oh, go ahead.
No. You're not in it. Are you at an ER? Are you at an ER? What the fuck are you even talking about? If they had a serious incident in an urgent care, they would have called an ambulance to transport that person to an actual hospital, Chantal. Do you think that we're all fucking stupid? They don't treat stuff like that in clinics, okay? So, I can't even. Oh, gosh. So, garlic bread has already covered it now, too. I'm covering the Piggy version of it. Thank you, Piggy, and I'm glad that you didn't fuck up her face too bad this time.
You know, like, it's so different here. So then you go to the nursing station, which is always right next door, kind of. It's like in the same building. And I got an injection. I still don't really know what it is, but it's basically the strongest painkiller they have for injection.
Oh, they didn't give any sort of paperwork on the way out, I guess, right? They didn't get any paperwork telling you what you got, right? You have no idea what the hell they did to you and what your follow-up procedure is. They did not give you any follow-up paperwork, right, Chantal? Oh my God, even with you.
And it's also vitamins. I got an injection for vitamins, and I'm guessing for vitamins it's B12. Because are there any other vitamins that they inject? I'm not sure. And it's like hospitals and clinics here are kind of like almost the same. The healthcare is very different. I actually slept in, so I didn't moon the sun today. I was at the clinic for like an hour.
Chantal, you can't get vitamin D through a window. You do understand this. This is why, like, you can drive in your car, and if you have your window up, you're not going to get sunburn. But if you have your window down, you can get a sunburn. You can get a pretty bad sunburn. Like, I did a cross-country trip in a vehicle that didn't have any air conditioning, and I had to keep the window down the entire time. And I was lobster red by day one. But you keep that window up, and it actually prevents the UV rays from coming into you. So the idea that you're going to somehow get the benefits of the sun. I know FFG was coming at you hard for, oh, I need vitamin D from the sun. Well, first of all, you're not even talking about it properly. Generally, well, my gynecologist told me that as I reached like mid-40s, so slightly older than you at the time, that what I needed to do was get at least 15 minutes of sunshine on my chest without any sunscreen each day. and I needed to take vitamin D supplements. Okay? Because that's what happens the older you get, right? You're not quite to my age. I'm 10 years older than you. That's why, like, some of your experiences, like your Richard Ramirez story versus Gypsy Rose and shit like that, I'm like, wait a minute. You weren't even fucking alive when that shit happened. Come on now. Okay. We're gonna check out Gorlick Bread as soon as I'm done with this bullshit.
Thanks, Gore. Debilitating. Yeah, it could be a herniated disc. I'm really trying not to get surgery if I don't need to, so I'm...
Stop trying to self-diagnose. Fucking get the tests. If they think you need tests, then get the goddamn tests. If you need an MRI, a CT scan, X-rays, whatever it is, but get the fucking tests. And stop being a whiner about it and be like, oh, I don't know, I might have herniated the disc, I have no idea. All right, cool. Then maybe they'll stick a probe up your vagina to do an ultrasound and see if you have a herniated disc. Let's see how that goes.
Just gonna rest for now, you know? I have a lot of weight on my back. You see how I carry my weight? Like, I have to hold myself up to, like, not tolerate the pain. Something is not right. Sciatica, usually, it's usually from a hernia.
Don't try and educate your audience about sciatica, because you clearly have no clue what it is and what it feels like. Okay? So please don't do that. Stop acting like Dr. fucking Foodie Beauty. That is not who you are, and you can't be giving medical advice to your audience.
Or bulge discs, I was told.
Oh, God.
The pain can go away, like, on its own, so I'm just waiting to see before I go and get all kinds of testing and, like...
Not on its own. Through stretching. Physical therapy approved stretching. You dumb bitch. I can't even with you.
Everything else. I don't know how surgery would be dangerous. I'm not sure. Yeah, all my weight is in the front, right? It's exactly. I mean, it's the strongest painkiller, but it's not. I read that, like, morphine, it's not morphine, but it's probably like a cortisone. I don't know what it is. The thing is the prescription's written in Arabic, so I can't really tell, and Salah can't make out the chicken scratch.
Yeah, you totally did not actually go to the doctor, because as a Western woman, they would have given it to you in English. You're so fucking full of shit. I can't even.
And I just don't even bother asking the nurse because they don't speak English. They don't understand me. So I just kind of just don't even care. I'm just like, give me whatever. I trust the doctor, you know. Blue Pot, actually being on your back is one of the most comfortable positions because your spine is straightened out. Yeah, I'm trying to lose weight for...
No, it's not, because you need the curvature of your spine as well. So basically you have to put, if you're going to be lying on your back while you're in pain, you got to put some pillows under your knees so that your legs are bent, and that's how you flatten your back without having undue stress on your... I can't even, like, I'm not a doctor either, you guys, but I've dealt with literally the exact sort of pains that she's trying to describe, because she goes to channels like me to swipe our conditions and use it in her storyline.
Sure, like, I don't know if I'm trying. I try every day to just, like, make proper decisions. Oh, yeah. I have a whole video coming out after this about, like, my way in. Yes. I know the majority of Kuwait can speak English, but the clinic we go to, like, some of the clinics, the doctors don't really speak like we've had doctors that don't speak a lot of English. The nurses.
But Salah speaks the local language, so what's the problem here? If you have a husband, my husband, who can translate, and you've said that that's a huge benefit for you, is that he's your translator, what the fuck is the problem here?
Either. Have you thought about coming back home and visiting doctors? No, yeah, you're not rude. But no, I don't, like, especially now, I could never travel that long. 12 hours sitting. I'm pretty sure that had something to do with messing up my back, because I remember being on the plane and every so once in a while trying to readjust myself, and like the pain in my back was severe then.
Maybe you should have actually gotten up in the aisle and kind of stretched out a little bit during your plane ride. Maybe you should have actually gone to the goddamn bathroom and squeezed your fat ass body into that tiny little area where they have a fucking stall where you can actually, like, go to the bathroom. Maybe you should stop acting like a stupid ass whiny child.
So, my favorite meal lately, I've been, like, so usually we order, like, a huge, like a main meal, like, once a day. And
she is such a sucker to these trolls that follow her and keep wanting her to talk about food. That's constantly on her mind, and she's such a sucker to it. They're like, oh, but what do you like to eat? You know, I know that you're in tremendous pain right now, foodie beauty, but let's change the subject to what you like to eat, because, you know, I'm a feeder and I want to see you really fucking plump up. I want to see you get really fucking big, right? That's how your audience does.
And I just have, like, something small at night, like, you know, bread, cheese, or something. I don't feel the effect. I still feel...
Bread cheese? What the hell is bread cheese? What the hell is bread cheese? What's bread cheese? And how do you hobble yourself into the kitchen to do that? Because I know Salah is not... He's not there all the time, right? I know you're lying about how committed he is to taking care of you. Plus, doesn't he have a goddamn job? And didn't he just get a surgery? What the hell is wrong with you that you think that we would believe this bullshit?
You know, the pain is always there. There's always some kind of pain, but when I'm laying on my side with, like, a pillow between my legs, it's the most manageable.
Lying on your side. I don't know why you decided to go back to laying just because you heard garlic bread say it. It is inappropriate grammar. The correct grammar is to say, I am lying down. I am lying on my side, because I am a person. An object lays, a person lies. Why is this such a difficult concept for you to understand?
But standing and sitting, oh no. Ouchie, ouch. I do get a huge needle, but it's like in my hip. Like above my buttocks area. Mm-hmm. I don't know how to do anything on this freaking thing. Oh, here we go.
That's not sciatica. Sciatica is a shooting pain down your leg. That's what it feels like. It is an electric shock down your leg. You are full of shit.
Where have you? I'll just remove it. All my life. Ugh.
She tried to sing again. That's interesting. Okay.
Ooh, get the ice cream sandwich.
No, Jordy. No. Let's look at garlic bread.
What is going on, guys? Welcome back. Commentary for Ray Chantal has done a live stream that started off with her normal silence. She then says hello to everyone for what feels like hours, but is probably only 5 minutes, and clearly did not follow through on her retro react. So we'll see if tomorrow brings the gaming stream she promised. I just do
Right.
want to say, because I don't a lot, it's 3:30 a.m. there, and she's still awake. She says that's because her and Salah had a nap, and now their sleep patterns are all messed up. She says she wants to provide a health update, but she needs to fix something, and she'll be right back. Despite literally just going live, she mutes the microphone for a few minutes and then comes back to say that they stay up late all the time. It's the weekend in Kuwait. It's very busy, and this is normal. After all, she has no reason to go to bed early. She says her trip to the clinic was very interesting. She goes over the fact that she can't film in the bedroom and how painful it was getting dressed. She reads a commenter talk about a theory that people have that she can't show her face on camera because of what might have happened with Salah. Now, rather than just simply show...
That's exactly why she put that picture up, because people were talking about how her face was swollen and how she all of a sudden went dark, right? So people were speculating, well, is she getting smacked around, right? Because she's not showing her face anymore. So she shows this weird wheelchair photo with, by the way, the side of her face that's swollen was on the other side. So I don't know what's going on there.
The picture of her in the wheelchair and say, well, here I am, I'm just fine. Why would you think that? She must instead infer that it's the flawed logic of the reaction channels that should ultimately be applied to them. So now everyone that doesn't cam up does so because they're being mistreated. The chat offers that the reason people felt this way was because the text messages we saw to Kybella. Chantal again defers and says, text messages aren't real life.
This is Wild Alaskan Company. Wild
Says, text messages aren't real life.
Oh, no. No, Chantal. I'm sorry, but I love my boyfriend probably more than you love your husband, in air quotes. And if I found out he was cheating on me like that, fuck no. He'd be out so fast. And I'm sorry, but that's just not acceptable behavior for a companion. I don't know why you're trying to make this acceptable in society as an influencer on social media, but it's fucking gross. This is one of the reasons I watch the eating disorder channels, because I'm trying to figure out like what kind of information is going to be delivered to my granddaughters as they grow and they ultimately get on social media. Like, what are they going to be told about social relationships and stuff like that? And if you're telling my granddaughters that they got to accept that bullshit, I'm going to have a problem with it, Chantal. I'm going to have a goddamn problem with it.
She does show the image of her, of course, in the wheelchair and says, while at the doctor's office, a true emergency happened. So they had to wait and be seen by more than one doctor. She did get another injection. She's still not sure what it is. She assumes it's the strongest painkiller in the land.
Oh, right.
She says, again, all the symptoms are sciatica. But she says now it might be a herniated disc. She says the way that she carries her weight could have done this, and the fact that it's slightly improving is giving her hope. So she wants to wait before she gets any imaging done, assuming it's just going to heal. She says that a weigh-in vlog is going to be up soon, and that she trusts the doctors in what they're doing. However, if you keep in mind, she constantly goes to the doctor for medical advice in terms of her weight or health or diabetes, and she follows none of that advice. But now all of a sudden, with this back pain that they haven't diagnosed properly, she's trusting what they say. To that point, she says she just wants hummus, chicken, and salads. That's all she's been eating. But then later in the video, she admits Salah's been bringing her cheese and bread. She says the vaping isn't impacting it because the chat acts like it could. And she says that the next flight, she now must go business class because she fears sitting for 13 hours factored into all of this. She says there's a ton of things she wants to do, but she just simply can't right now. But one thing she's not going to keep doing is living in denial that when people say she's not healthy, it's shaming her weight, that it's just an accurate statement. She said she's going to be getting a cane and she needs a grabber, stating that today some pita fell out of the freezer and she couldn't pick it up until Salah came back. The chat, of course, of supportive as they can be, bring up her favorite desserts, chicken royal, other foods.
Oh my God.
They ask her to go over her favorite takeout places, the ingredients to the pot pie that she made. And of course, they tell her that we refer to her as the Penguin from the Batman movies, and the cane will only make that bear a greater resemblance. She says that's okay, and she's not going to get a motorized scooter at this point, but she may have to in the future. They ask her, what's the best part of being bedbound? And she says,
yeah, she can't even, look. I weigh a lot less than Chantal, you guys. I'm 5'4.5", I weigh 145. Okay, I can't do a knee scooter like those little like shuffle things where you put your knee on the scooter and you kind of scoot along. I can't do that because it's going to be too much pressure on joints that hurt. Because my right knee slipped in 2008. So that has problems. And my left knee was bit by a fucking attack dog. So there's no way I can do a knee scooter. I can't put pressure on these extremities like that. And the fact that she has a giant ass gunt that's coming down halfway down, at least halfway down her thighs. She can't fucking put that much weight on something like that. A motorized scooter, maybe, but is her apartment handicap accessible? She's never really made that clear. If there's ramps, if there's handicap parking. I don't even think she's ever asked for a handicap placard. Despite the fact that she says that she has all these mobility issues. I have a permanent handicap placard. And yet this woman says that she has these debilitating, terrible crisis issues. Won't get the tests. Because she probably needs to be sent to some sort of like farm animal facility to actually get tested at this point. She's probably not going to fit an MRI. I just don't know how she has gone this far without asking for a handicap placard. You know? Like, that's the biggest one for me, is that, oh, really? You're in this much pain? Okay.
it's the fact that she can be lazy. She says Salah is having his operation, so they're likely going to need to get help around the apartment. Despite continually ordering takeout, she says this is acceptable because it's going to, quote, give someone a job. And the person...
I thought he already had his surgery on Sunday and he's already been taken care of. Are we saying the date got moved on his surgery? Is that what's happening right now?
that they hire could ultimately cook for them as well. She says the apartment is just too much for Salah to handle on his own, and she goes back and forth as if he's had the procedure done and then hasn't had the procedure done, and then kind of goes into the fact that it's related to his ingrown toenail. Of course, people bring up her weight, and she defers.
Oh, a toenail. I'm fairly certain that everybody's been saying it's a pilonidal sinus, which I'm quite familiar with what that is. So I think you're lying yet again.
To the upcoming vlog, rather than champion weight loss, which I found very interesting, she continues to just say wait and see. She says that she won't be long and then stays online for nearly another hour. She says that the vaping hasn't hurt her dieting. She isn't hungry. She says the vlog is going to be up in an hour, and she leaves you with the impression that she just came online today so she could get super chats now that she's getting them back, rather than actually make the video. She says right now she has a recovery plan. It's to lay in bed, eat healthy foods, and hope things go away. So I'm not sure where that actually came from, but clearly she's not going to be getting imaging done anytime soon, and she offers that just thinking about it gives her anxiety. She then starts loudly blowing or maybe even snorting, and she apologizes and mutes the microphone. She comes back and says she has TMI to share and that she's clearly been very congested and overanalyzing what's been coming out of her nose. The chat urges her to look into getting a bypass. She says that that would needed to have been done in Canada and she doesn't plan on going back. She says also that's not the simple fix that maybe she thought it was. And of course, this gets interrupted by her food cravings. They tell her that she can't give in to the cravings and be successful with her glow up, much less the bypass. And they question, in a way, how she can laugh and vape, yet be in so much pain. She responds that it's just the position she's in that makes it okay. She goes on to talk about her need to sew her hijabs.
Well, I can tell you straight up, girlfriend, that I was in, like, actual writhing pain. I know you somehow edited that word out of your last live stream when you said a writhing baby, and now all of a sudden it's not there. But actual writhing pain is, I'm in so much pain that I'm like yelling and crying to my friends, right? That is the kind of pain that I was in when I lost 70 pounds. I was still on a blood pressure medicine that had a water pill in it. And it was doing something to my internal organs because it was still trying to drain water, right? So I had to go in and get a new prescription. And they're like, oh, well, you probably don't need this water pill anymore because you've lost so much weight. And then the pain went away. But that was writhing pain, okay? Also, writhing pain is getting bit by an attack dog and then being given modified duties that exacerbate the pain, right? Which cause you to go into pain cycles at like 3 days at a time over and over again, right? I don't think you really, like, as fat as you are, I get that you probably have back pain, but I don't think you've ever experienced real pain. I don't think you have, because you've never done any real work. You've never done any real jobs. You've never done any physical activity that would potentially put your body over the edge. Instead, you are one of the laziest ass motherfuckers I've ever seen. I can't even.
About this, quite frankly, for months. And she says that they should not be expecting a second part to the Q&A because she accidentally deleted it when deleting rage posts. Now, just a side note to this, as a content creator, your videos and your community posts are generally housed in different tabs. So I don't know how she could have accidentally deleted it. I also don't know why she might not have a backup copy of it. But then again, you also have to confirm exactly what you're doing. It doesn't just let you haphazardly delete videos. So I'm actually going to take the concept that she never filmed it, people asked for it, and this was her excuse out. She says Sala and her have been playing games to pass time, and she's just been watching a bunch of TikToks. And she talks about photos that people are showing from her past, and in a way she kind of wishes they weren't out now. And honestly, that would have been a perfect time to have segued into the retro react, but she just writes it off as times where she was single and having fun. She just trusted the community and that, you know, it was the culture she was experiencing. OF was popular at the time. She then goes on to kind of say that she made good money on OF and that she had a good amount of people following her, which from what I can recall is completely false. She also writes all of that time off as, quote, just being a beezer. Someone then in the supportive chat, of course, asks her to go over the history with FFG, and she says little more than, quote, hating her is a lucrative business. She goes over FFG's failed weight loss and the fact that FFG, she says, gets way too involved with her real life. She says she's over the mentality of going and raging, puffs away on her vape. She gets frustrated that people steal her content, go in real life, and that she just responds to it. And I just want to point out, because I normally don't, but Chantal had no issues with people in her community going and getting information for her that she would share. And then now she's kind of sitting there and saying she didn't do any of those things, but she was directly involved in doing those things and using the information that was provided to her. So to sit there and project that she wasn't playing any role in that is quite hypocritical, Chantal. She then abruptly says she needs to leave to edit her vlog.
The hypocrisy!
Not before calling reaction channels trashy, uncultured, stating she doesn't need to go to mosques. And then she seems shocked that StreamYards and OBS are actually different programs and tells everyone we need to stay tuned for the weight loss vlog, which of course I will cover when it goes up. You have my word. I appreciate you watching this recap of what was probably an hour and 30 minutes in less than 9. I'm going to leave you with the top comments from the last video. Be back as soon as I can.
Okay, I'll leave it there. The hypocrisy! My husband! Well, first of all, I mean, you seem like a shitty dude. No pun intended. But I hope that your surgery went well, and I hope that Chantal actually helped you. I'm not unfamiliar with that surgery, okay? I get how difficult it can be to recover from it, but it's only like 3 to 5 days, so you're probably pretty close to the end of your recovery. You're probably fine. But I think it would be embarrassing as fuck that your wife has this healthcare story arc to try and make it out that she can't fucking help you. I mean, it would have been a better story for her to be like, well, I'm taking care of my husband right now because he just had surgery. I was talking about this with my boyfriend the other day, and I'm like, could you imagine, like, if we lived together and we're responsible for each other in that regard, right? And you were going to have a surgery, and I said, nope. All of a sudden, I'm in so much pain. I can't help you. I cannot help you in this moment. And in fact, I'm going to do a lot of podcasts and kind of like try and get a bunch of like attention for the fact that I'm in much more pain than you. Look, I'm in a lot of pain, you guys. I have a permanent nerve condition that I'm still getting treated for. I'm going to be starting a very intensive physical therapy program on Monday to try and bring me back to like restore the strength in my leg. And I obviously it's not going to kill the pain, but it hopefully will restore like the muscle atrophy that I've experienced. And that starts on Monday, and it's going to be 4 hours a day, 5 days a week. Would you do that, Chantal? If they told you that that's what you have to do to resolve your situation, would you be like, sure, I'm all for it? So basically what they're telling me is I'm going to have physical therapy, I'm going to have group therapy, I'm going to have yoga, and I'm also going to have like mental therapy. Would you do that, Chantal? I don't think you would. I care about my health. I'm not making it up. Okay, so like when I talk about like what's going on with me online, it's not like a fucking storyline. But you're like, I don't know, it's just so painful to actually get to the doctor. You literally have a husband who can drive you to the doctor, and you can't even help him when he has a minor surgery. That's so gross. The two of you are amazingly bad. Amazingly bad. I don't even know what to say. I don't know what to say.